Bismillahirrahmanirrahim. I'm Halah, fourth year medical student. I'm going to speak about acute limb ischemia. First of all, what's acute limb ischemia? When there is an interruption of a blood supply and it occurs suddenly, that would be called acute limb ischemia. It's mainly occur in the limbs and more specifically in the lower limb. And in that way, there will be no time or no chance for collaterals to be formed. The main three causes of acute limb ischemia are embolus, thrombosis, vascular trauma. Regarding emboli, there are three main sources of emboli, mainly heart, which account for about 90%, like in cases of atrial fibrillation, valvular heart disease, prosthetic heart valves, and if there is history of myocardial infarction or atrial myxoma, which is a benign tumor of the atria. The second main source of emboli is arterial sources like atherosclerotic aorta or aneurysm. The other causes can be from medications, mainly oral contraceptives or malignancies. Emboli occur more frequently in the site where branching occurs, mainly in the bifurcation of the aorta, the common femoral bifurcation, and popliteal trifurcation. As I said, it's mainly occur in the lower limb. Femoral artery account for about 45%, followed by aorta and iliac artery, then popliteal, and finally tibial artery. Regarding thrombosis, which is the second cause of acute limb ischemia, it can occur either in pre-existing atherosclerotic artery or in normal artery, mainly in patients with hypercoagulable states, patient with malignancy, and polycythemia. The third cause, trauma. Vascular trauma mainly can occur by penetrating trauma, like in case of arterial catheterization angioplasty, or as a result of blunt trauma, like in case of supracondylar fracture of the femur, which lead to popliteal artery damage. How the patient with acute limb ischemia present as the following 6 P's. First presentation is pain, which is sudden and severe in its nature. It can be described as numbness. The patient will also present as pale, will have pallor. There will be absence of pulse, pulselessness, and there will be perishing with cold. The patient is almost dying, squeezing because of cold. At the late stage, there will be paresthesia, which is abnormal sensation, and paralysis, and this is mainly in severe ischemia. Regarding the investigations, the basic investigation will be FBC, looking for polycythemia. Also, we'll investigate for urea and electrolyte to see if there is any complications, mainly renal impairment. We'll look for clotting screen, for arteriography to visualize the arteries, for ECG, cardiac enzymes to see if there is any risk of MI or previous any history of MI, Doppler ultrasound, and duplex imaging to see the flow and the presence of the pulse. Management, the immediate management of acute limb ischemia is anticoagulant, mainly unfractionated heparin. This is in case if the cause is atherosclerosis, mainly thrombosis, to prevent the progression of the thrombus. The patient also may undergo embolectomy, which is surgical removal of the embolus. The patient will this will be performed under local anesthesia using Fogarty catheter. A groin incision will be made. A catheter will be inserted to withdraw the embolus. Also, the patient may be given a course of thrombolytic agents, mainly streptokinase, urokinase, and tissue plasminogen activators. Those are percutaneous intra-arterial thrombolytic therapy. They work approximately in about 12 to 72 hours to dissolve the clot, and they are working mainly by conversion of plasminogen into plasmin to prevent or to cause breakdown of fibrin to prevent the coagulation. That's it. Thank you.